I'm Niall Paterson, and on this edition of the Sky News Daily, well, there are two stories that we'd like to cover. Later, with the vaccine rollout having been brought forward, we'll bring you the very latest on COVID and the newest variant. But we begin in Morocco, where a magnitude 6.8 earthquake struck on Friday. Its epicentre, a group of remote villages in the Atlas Mountains, 45 miles south of Marrakesh. More than 2,000 deaths have been identified so far. Relief and rescue workers from Morocco and elsewhere are searching for survivors in the piles of rubble, whilst simultaneously trying to get food, water and shelter to those who've been displaced. Our chief correspondent Stuart Ramsey and his team were among the first to see the devastation. Just a heads up, the quality of his audio is not great, but I think that's understandable given where he was.
Well, I'm in Talat Mayakub. It's the epicentre of the earthquake, and large portions of the town have been destroyed. The epicentre, of course, is usually, and here particularly, was like an explosion. It wasn't like, what we imagine. I mean, I've been in quite a lot of earthquakes. Many are, you just get shaken. But they are like explosions. I remember in Haiti when I covered that earthquake, that's exactly what that was like in a place called Leogan. It was completely destroyed. Well, that's exactly what I'm seeing here, whereby, I mean, there's not a building standing here that you could describe as usable. It may not have completely fallen over, but you couldn't go in it and use it at all. That's why everyone's outside. It's basically become the headquarters and the base for the relief effort into the mountains that are all around us. So there are a lot of ambulances here. And they are treating people that have just been brought in from the mountain regions, they're very distant mountain regions that we have been to today. We are amongst the first to get there. We had to walk in. We went in with the military, and we were staggered to find them getting people out alive. They weren't digging them out of the houses themselves. That had already happened by the local people, we believe. But the military went up, followed by ambulances, and now there's more aid workers trying to get through there with supplies for people, because they have been cut off since this began. They haven't been able to get off the mountain because they're either too weak, too distant, and the roads had gone. We saw a lot of helicopters today, or a number of drops by helicopters today, who were flying over remote villages and dropping relief supplies. It's chaotic, as you can imagine, but it's definitely getting better as days go by. In this area where I'm standing right now, it was widely acknowledged, I think yesterday, that nobody would survive. Nobody would be found alive anymore, but you can smell the bodies of people still here everywhere you go. But the real surprise today has been the numbers of people who survived in these remote towns and villages and were pulled out of the rubble and have been brought to safety. So it's been a good day, I suppose. There will be more dead there, there's no doubting that. But any survived after all these days, and really precipitously built villages. So if the mountain slips, they slip off with it. So that fact that they've made it out is remarkable in itself.
You must have spoken to a few people on the way up and down those mountains, Stuart. People who'd lost not just, every single member of their family, but every possession that they have, every strip of clothing that they possess. I mean, this is a part of the world where things are going to have to start from scratch for an awful lot of people. Those lucky enough to survive, of course.
Yeah, it was a lady who was waiting for more of her family members to be dug out of the family apartments. And now, she'd already lost 10 members of her family, and there was no... people have very meagre belongings here. So, quite often when you see something like an earthquake or a hurricane, you can see a nice house that's been blown over, and you can see the TV and all this. People are pretty poor, so there's not a lot of that stuff around. A real heartbreaker today was a very upset man walking down the mountain with his wife and his two daughters. He had dug them out, but he lost two other children. So the family, of his 4 kids, he saved 2, and 2 didn't make it. And he was incredibly distraught. And his wife was angry that nobody had come to help them. And I think she definitely believes they would have got the other 2. So that was a real killer. And they have lost everything. I asked them about what's left up there, and they said, "We're done. We're gone." Another gentleman saying, "We're not going to stay here." And I think quite a few people that we've spoken to in the last few days, some have said, I don't know if they'll ever repair this place, but maybe I won't even wait to see. So, some people say that's the end for them. I thought we might never see anyone actually living while we covered this story, but it just goes to show if those relief teams can get up to the mountain areas, if the army can climb up there, they can get people out and they can bring them down. And so if there's no point in saying or any discussion about, it's all too late, they can't last these many days, as we know over many, many earthquakes in the past, that actually humans' resilience and ability to survive incredible catastrophic events is remarkable. And today, it was great to actually see these people, though I have to say, quite a few of them looking pretty poorly, very bruised, very damaged. We're lucky to have lived.
Thanks, Stuart. Much more in just a moment when we'll be talking COVID, ahead of what once again looks like a difficult winter for the NHS. COVID, try as we might to forget it, it does keep popping up. And as we head towards the winter months, which have always tended to put pressure on the NHS through increased respiratory infections, now a highly mutated COVID variant is spreading around the world once again. Called BA2.86, we are still in the process of gathering data, including on the efficacy of our existing vaccines. And so, UK health officials have brought forward plans for autumn flu and COVID vaccinations. On this half of the podcast, I'm joined by Professor Susan Hopkins, Chief Medical Advisor at the UK Health Security Agency, to help answer the pretty fundamental question. Going into autumn and winter, should we still be concerned about COVID?
COVID case numbers overall are lower than they have been for many years at this point. But actually, over the last number of weeks, we've seen rises in the COVID case numbers. We are more concerned at the moment about the new variant that has emerged over the last number of weeks called BA2.86, which has a high amount of mutations compared to what was circulating in the past. And whilst the numbers globally are still low, in our latest report, in our technical briefing, we're highlighting 34 cases in England that we have now identified. 28 cases of that is from a single cluster in a care home, and that's showing that we are seeing some high attack rates in individuals with vulnerabilities. It's too early to say what that's going to mean yet, but that's clearly the reason why we've recommended bringing the vaccine campaign forward.
What more do we know about this new variant, BA2.86? Anytime that a new variant arises, as you will remember, people tend to be quite concerned.
This new variant has about 30 mutations compared to Omicron when it emerged in December 2021, and about 50 mutations compared to the original wild-type virus that emerged in March 2020. And that's a substantial difference. What we know from those mutations at the moment, and what we can predict from our knowledge, is that it's likely to have some evading effect of the immune system compared to the variants that we've seen in the past. We do not yet know whether it's more transmissible, whether it causes an increased infectivity, and we have no evidence whatsoever on severity yet. And that will take some time for us to realise and understand all of these factors.
Do we have any idea what the level of efficacy, the level of effectiveness of the vaccines is when it comes to this variant?
Given the fact that globally there are still less than 100 cases have been reported to global databases, and as I've said, only 34 cases in England, it is far too early to give you our traditional vaccine effectiveness type analysis. There are some early laboratory data being released as preprints. That means that it's unvalidated, it's unpeer reviewed, and all of those show that there is a degree of immune evasion of this variant compared to the variants that have gone in the past. It's not zero, and so having had infections and having had vaccines previously, we believe will go to protect people from severe disease. But it may be that, especially if you are more vulnerable to infection, are immunosuppressed, are more elderly, where your immunity wanes faster, that you would be more likely to be affected.
Just so we can put this in terms that the layman and I can absolutely understand here, Susan, when we're talking about immune evasion, we're in this essence saying that our immune system, which presumably if you've had COVID has a little bit of immunity built up, if you've had vaccines, you would have had a little bit extra immunity built up, that despite that, this might be able to get round the natural defences that we've had and the defences which we've added to with vaccines and boosters?
Absolutely. So what we're saying is that people could get an infection, but the highly likelihood is that the vast majority of those infections will be mild. The vast majority of people will potentially not even notice they're being infected. But what we may see is that in the older populations, more infections in that population in particular. And that's the reason for bringing vaccines forward.
And again, just to be absolutely clear, because strangely enough, this is something that I've heard from, locals in my local pub. I mean, do the tests that we have at the moment, are they capable of detecting this new variant?
So we will formally study that when we have enough of the virus in the laboratories growing. However, the individuals who have tested positive so far were all detected on either lateral flow tests or PCR tests that are in circulation. There's nothing in the virus genome, so the virus DNA, that suggests that there's anything that would mean the test wouldn't work. But obviously, formal testing occurs every time we see a new variant like this.
Just in terms of the public health advice, if someone right now fears that they may have COVID, fears that a loved one may have COVID, finds out that they do have COVID through one of the tests, what is the advice?
So the advice for this is the same advice that we've had now for more than a year. So we advise somebody if they have respiratory symptoms with or without a test, that they should try and stay at home if they can. If they need to leave the house, they should take precautions to reduce the risk of infecting others. And that is really as much as possible to avoid seeing vulnerable people, be that vulnerable people that they may have friends or family or in care homes. So avoid that for a while, the duration that people are unwell. And if they need to do something such as go to a hospital where they have an appointment, make sure they inform the hospital beforehand. If that hospital appointment is essential, then wear a face mask or a face covering while you do that. That's the same advice as we've had for the last 18 months. And that is really important advice as we come into the winter when more respiratory viruses circulate. If you have a COVID test, we would say follow that same advice. But if you even don't have a test, but have respiratory symptoms and feel unwell, that advice is worth following.
Of course, all of this is taking place in tandem with the COVID inquiry that is happening at the moment. What are we learning as we go? And of course, there are interim reports and there will be a final report, but what are we learning about the way in which we dealt with COVID the first time round?
The first part of the COVID inquiry has taken place. And in that first part of the COVID inquiry, they looked at the preparedness and what we could do about preparedness in the future. The second part of the COVID inquiry looks at the response. As an organisation, we have continually reviewed and identified the lessons that as we were going along, and we have integrated those into our planning for the future, into our organisation and how we deliver things right now for this outbreaks or any other outbreaks that might come along.
I just wonder, though, as the kind of chief medical advisor to UKHSA, I mean, do you think that as a nation we are currently better prepared for another pandemic than we were at the time of the first lockdown in March 2020?
Well, I think I can only respond in terms of our organisation. And I think in terms of our organisation, we have worked very hard to be better prepared. We've learned a lot. We have teams who have experienced the challenges of delivering a lot of different components of surveillance, testing, tracing, guidance, working with stakeholders throughout this pandemic. And all of that is incorporated into everything that we do.
Let's talk about the vaccine programme. And of course, it proved hugely effective when we were dealing with COVID the first time around. We are now in this situation where, as the phrase goes that we often hear, we now have to learn to live with it. What effect does that have on the vaccine booster and vaccination programme? Is that something we're going to be seeing, annually, like a flu booster if you're above a certain age or you fall into certain demographics? Or does there still remain the possibility that we will be rolling out another set of vaccines for the population at some point soon?
Yeah, so I think the main population group that are recommended for vaccines are the over 65s, those in care homes or residential homes, those who are immunosuppressed, and pregnant women, or those living with those people who are meeting those high risk groups or immunosuppressed populations. That's now going to happen this autumn. We will review the data and the immune response to that and determine whether those future campaigns, taking advice of the Joint Committee for Vaccination and Immunisations and their recommendations, We're not yet into a stable position with this virus. It's not even 4 years since it's existed. And therefore, I think we will need to look at the seasonal patterns as we go forward, or the unseasonal patterns that we might see, to determine what the longer term vaccine strategy. As a country, I believe that we'll continue to provide vaccines, if necessary, to those at the highest risk of severe disease. And that's the right approach, in a similar way that we do for flu. I think the frequency of those vaccines and the timing of those vaccines is still up for ongoing discussion as we learn more about this virus.
But if we are not mass vaccinating, and that sounds like that's what I'm taking from what you're saying right now, should we then expect that there will be significant effects if this variant proves anywhere close to any of those that have come before? But we should expect significant effects on education, healthcare, so on and so forth. You know, if people are not getting a vaccination, those that get it, well, some of them will have to be off work for, you know, at least a handful of days, won't they?
Yeah, some of them will be off work for a handful of days, but many won't, because many people now have very mild asymptomatic illness and don't even know they have it. But each time they're getting a very mild component, it gets a boost to their immune system as well. If we look back over the last year and a half, we've had a number of waves of new variants coming in and circulating in the community. It has not disrupted schools. It has not disrupted the economy. And I think that there have been healthcare pressures. Healthcare is frequently used to having healthcare pressures due to respiratory infections. And I think everything we're doing is trying to mitigate the hospital pressure on that by vaccinating those who are most likely to go into hospital. I think, you know, if we look at the data, more than 70% of the people who are admitted to hospital with COVID are over 65, which is why that group is the most important group to vaccinate.
Susan, do you think that people would wear masks again if mandated to do so? The reason I ask is there is so much negative feeling, negative assertion, I should say, probably, from newspapers, radio stations. I think they've even got a couple of TV channels doing it these days. You know, lots of people, you know, apparently well informed, at least according to the people that watch them and listen to them, saying that masks were a joke the first time around, and why on earth would you ask me to wear a mask again? Do you think that enough people would do so if they were asked to?
Firstly, I would say is that wearing a mask was a particular measure at a particular time in the population. It would need to be in extremis, with extreme challenges to the health system, before that widespread mask wearing, I think, was even asked of the population, never mind mandated.
Yeah.
So that is a very big jump from where we are now. And I see nothing in our near future that suggests that that's going to be anything that we would need to do. However, I think if we saw something that was causing severe disease in the population, I think if we saw something that was overwhelming the health system and being able to provide care for the health system, and people were asked, then people are intrinsically capable of making the right decision if they were asked to do something.
Susan, I can predict, and we haven't even finished the podcast, but I can predict the criticism that I will get for doing this podcast will fall into one of two categories. On the one hand, scaremongering. What on earth are you doing? There isn't a problem there at all. On the other hand, it will be people who simply deny that COVID was ever a problem, or indeed that the vaccines ever helped out. We are heading into winter. We both know that when respiratory illnesses crop up en masse at that time, it can make things very, very tricky when you have a coronavirus like this in circulation. Honestly, how concerned are you as we just nudge just that little bit closer to winter?
So winter is always a challenging time for the health system, with the range of respiratory viruses that we see circulating in the population and that require admission to hospital. I think, as with last winter, I think that the challenges that the health system have to deliver, the elective recovery work that they have to do, means that everything we can all personally do to reduce the transmission of infection is important, be that COVID, be that flu, be that other respiratory viruses as well. So I am always concerned coming into winter, but I am no more concerned than I was this time last year at this moment in time. I would ask people to take their vaccine offers, and for flu, for children to take that vaccine offer when they're offered in school or in the GP surgery as well, as it's the combination of all of these different viruses and the combination of multiple different respiratory infections circulating that cause the greatest impact.
Professor Susan Hopkins, great to have you on the Daily Podcast. Thanks very much for being with us.
Thank you.
And that's your lot for today. We'll see you again tomorrow.